Okay, Miss Cison is due for some meds. We're gonna be giving her some meds through her peg tube, and then we're gonna be hanging a piggyback. So I'm gonna wash my hands. Okay, I'm gonna check and verify my EMR, make sure I'm giving the right meds to the right person. And we are giving through Miss Cison's peg tube, we're giving metoclopramide. This is gonna be for her gastroparesis because she is a diabetic and is experiencing some problems there. We want to just get things flowing. So we're gonna give her this through a peg tube. And then we're gonna be giving her some affirmative on the piggyback because her pain is at a 6, and because she is allergic to morphine, this is a better solution. So for my peg tube, the supplies I'm gonna need in my clean med tray, I'm gonna have my metoclopramide, which is going to be 5 milligrams for 5 milliliters, and on her order it does say we're going to be giving 10 milliliters. So in here are already 10 milliliters. And then I'm going to have my irrigation tray, my sterile water. My syringe is labeled. And yes. Now for my IV piggyback, we're going to go ahead and set that up for my secondary tubing here. So I'm gonna spike my bag because my bag is already spiked. Before I spike my bag, make sure my tubing is clamped. Spike my bag. And I'm gonna squeeze the chamber, fill it halfway, and then I'm gonna prime it. I have my hanger, and then I'm just gonna label my bag. And it is compatible with the normal saline that is hanging in Miss Cison's room. And the rate of it is gonna be 400 milliliters per hour, and it's gonna go over 15 minutes. Now it's labeled. We're now gonna take all of our things to the room. I'm gonna take off my gloves and wash my hands.
Okay, go ahead. Come in.
Hello, Miss Cison. My name's Jasmine. I'm gonna be your nurse today.
Oh, hello.
How are you doing today?
Oh, could be better.
Okay, I'm gonna wash my hands and put on some gloves. Today we're just gonna be giving you some meds for your pain and for that gastroparesis. I'm gonna giving you some meds through your peg tube, and then also through your IV line. We're gonna be setting up a piggyback. I'm also gonna be doing 2 assessments. I'm gonna be doing a cardiac assessment and a respiratory assessment, and then we might be looking into giving you some oxygen because it is a little low. So I'll have my gloves on. So I'm gonna scan your armband. Can you tell me your full name and your date of birth?
Chris Cison, 4/1/1975.
Okay, and any allergies?
Just morphine and what was the other one?
Aspirin.
Just morphine and aspirin.
Okay, so I'm gonna go ahead and confirm that in the EMR.
Oh, I'd forget my head if it wasn't attached.
Okay. So I'm gonna be doing my assessments on you first. So I'm gonna do your O2 sats first. I'm gonna clean my pulse ox. Put this on your finger. Okay. And also take your respirations, but I'm not gonna tell her that. respirations, we're at 20, which is good. And your O2 is a little low, so we are going to be putting on some O2 for you. So there's that. I'm going to be checking your oral mucosa, making sure that it's not discolored, that it's moist. Checking the position of your trachea, making sure it's midline. Checking the color of your skin. I'm inspecting the chest, making sure it's symmetrical, that there's no drains going on. She does have a CVAD. That there are no scars, and everything looks good there. So now I'm going to be listening to your lungs. I'm also checking for pursed lip breathing, any coughing, any pallor going on, but everything looks fine. So I'm going to clean my stethoscope. I'll start on the left, listening to all 7 sides.
Left.
Okay, and then I'm also going to be listening to her heart. So start on the right. I'm also going to be listening to the apex of the heart for 1 minute. Everything's good there. And then I would listen to the back, starting from the left, going on all 10 sides. Okay. Alrighty, everything sounds good there. So let's go ahead and put on some O2 on you. So we're going to be using the nasal cannula. We're just going to go ahead and connect a new O2 tube. So I'm going to have a new Christmas tree being put on. I'm just going to pump this right through it. Alrighty. Then we'll set that on you. So we're gonna start you off with 2 liters and then see. We'll check back up on you, see if that O2 sat went up a little. So I'm gonna turn this on. My ball would be floating in between, right in the middle of the 2. Make sure my prongs are facing down. So I'm gonna see some with this oxygen. We don't want you to use anything that's petroleum based. No smoking, of course. Just make sure that we're not using anything that's flammable, because this is very, very flammable and can catch on fire. We're gonna tighten that. Make sure that's going. If she's had previous O2 already, we're gonna be checking for skin breakdown. Make sure anything's not dry, anything's not red. Alrighty. And because it's only 2 liters, we're not going to give her a humidifier right now. We'll see how she responds to oxygen, and then later on we'll add a humidifier if needed.
Mm-hmm.
Okay, so we're going to give you your medications now. We're going to go ahead and give you the affirmative for your pain. Can you go ahead and confirm your pain level for me?
It's about a 6.
Okay. Before we give you your meds, are you ready to take both of them? Are you okay with taking both of them?
Yes.
Yes? Okay, perfect. Armband. One more time, can you confirm your name and your date of birth for me?
Chris Season, 4/1/1975.
Okay, and any allergies?
Just morphine and aspirin.
Perfect. So I'm going to EMR, verify. I'm going to scan my meds. Okay, making sure that this is the correct med. And my EMR, this is the IV push. While I'm here, I'm going to go ahead and scan my metroclopramide. So we're going to give that right after. Okay, so your affirmative is for your pain, and it is acetaminophen, so it can cause some liver damage, especially if you are drinking alcohol while using this. So we just want to watch out for that. And you do have some normal saline going, so I'm making sure that's good, that the tubing is good. And then I'm also checking the site, making sure that there's nothing wrong with it. And then I'm gonna lower this using my hanger. Go ahead and hang this up here. I already primed this in the room. So now I'm gonna clean my port. I'm gonna attach this. Make sure this is unclamped. Okay, now we're gonna go ahead and set it up. Okay, we're gonna press channel select. We're doing secondary. We are doing acetaminophen. I'm gonna press here. Is that correct? Yes. This is going for 400 milliliters per hour, but we're only gonna do 100 milliliters. It's gonna go over 15 minutes. All right. So we're gonna start that. And I'm making sure that the primary has stopped and the secondary is going. And it is pumping through, so we'll get that pain under control now. Okay. So now we're gonna give you your metoclopramide. This is for your gastric paresis. This is just to help things get flowing, just because you're having a little stomach problems. It's gonna go in through your peg tube. So before I begin, I'm going to listen to your bells. I'm gonna clean my stethoscope. Also visually inspecting first, making sure that no guarding, distension, none of that, and then I'm gonna listen. Okay, everything sounds good. Okay, now we're gonna palpate. Does that hurt at all when I touch?
No, I don't think so.
No. Abdomen is a little hard, so hopefully this medication will help that. Okay. Okay. I'm also assessing the site, making sure there's no redness, no drainage, that this is the correct tube. You only have one tube going. You do have already a valve on, and then I'm also going to be measuring the tube from insertion to the end of it, making sure it hasn't moved or anything like that. We're also going to raise her to about 30 degrees, 30-degree angle. That way she does not aspirate while she's getting her meds. We're going to make sure that this is the peg tube, and it is. I'm also checking, see if there are any signs of intolerance, any vomiting, any diarrhea going on, any nausea going on. Nope. Okay. Oh. We're gonna connect this to the orange part. Also going to put down this towel so things don't get all messy. Okay, so I'm gonna go ahead and flush first with 30 mLs. This is my sterile water. I'm gonna open my valve.
That water tastes good. Oh, I'm just kidding you.
I'm going a little bit slow. Perfect. Okay, and I already scanned my metoclopramide. It's in a syringe, so we're just gonna shoot it right through. There it goes. go down. And now we're gonna flush with 30 mLs.
Does it have to be exactly 30 or can I have a little more?
We can have a little more.
Oh,
Keep
yes.
you hydrated.
All right.
Okay, I'm gonna take this off. And I'm going to clamp. Made a little bit of a mess, but it's okay. I'm gonna clean this up. You did good. You feeling okay?
Yeah.
Yeah? Okay. I'm gonna leave you elevated for about 30 minutes just because I don't want you to aspirate. We're gonna let the med go down. So, after I'm done giving all my meds, I'm gonna go ahead and document and save. You don't have any feedings going on, so I don't need to restart anything. I'm gonna dispose of all my stuff. Anything I need to throw away. I'm going to lower my bed down. Just a little. Okay. Take up any clutter, take off my gloves, wash my hands. Make sure my bed is locked, lowered. You have your non-skid socks on. Okay. You have your call light in your hands. Do you need your phone? Anything else that you need?
No, I hate my family.
Okay. Do you need to go to the restroom before I go?
No.
No? You in a comfortable position?
Oh, yeah, this is nice.
Okay. Missy, son, is that firm up working on you? It's been going for a while, so.
Yeah, it's
Yeah,
working.
Starting to work? Perfect. I'm glad. Okay, I'll come back to check up on your O2 sats. Maybe we can raise it, maybe we can lower the oxygen, and we'll check up on you, okay?
Okay.
Alright. Okay, I'll be back in about 30 minutes. This is almost about done. Take that off. And we'll check on you, so use your call light if you need anything else, okay?
Okay.
Alrighty. Thank you, Missy Son.
Thank you.